Federal health officials released some troubling new projections for COVID-19 cases. We were seeing about 2,000 new cases a day nationwide about a month ago. With restrictions being lifted, that has risen to 3,000 new cases a day. Health officials say if we don't clamp back down, we could hit 12,000 new cases a day by the end of April. Overall, more than 950,000 cases have been reported in this pandemic. Canada is likely to reach the 1 million mark by next week.
Suggests that these variants don't play a role in Canada is like suggesting gravity doesn't play a role in Canada.
More contagious variants of this virus are driving the latest spikes. Cases are rising in all provinces west of Atlantic Canada, including Quebec. Dr. Gaston De Serres is an epidemiologist with Quebec's Institute of Public Health. He says variants will continue to spread unless new restrictions are put in place. Dr. De Serres is in Quebec City. Welcome back to the program, Doctor.
Thank you for inviting me.
I want to talk to you about what we are seeing, particularly what's being reported out of Ontario. They are looking at doubling of cases in ICU. I believe it's a 60% increase in death in terms of what the Science Advisory Table is saying it's finding, both within its own jurisdiction and looking at the evidence elsewhere. Does that match what you're seeing in Quebec?
Well, I don't think that we have data at this time to say how much more deadly these variants are, because we still have a fairly limited number of patients who have been infected with variants. Having said that, we see a quite rapid surge of these variants. And I think that the various countries who have been dealing with variants have reported a more virulent infection, meaning that there were more complications and hospitalizations and deaths.
And in the province of Quebec, you laid out some modeling that talks about both what sort of the short-term future of variants and a possible more medium, longer term. What is it that you're expecting to see?
Well, what we presented today is that we have sort of two epidemics. We have the epidemic that was driven by the historical coronavirus, so the non-variants, and we can see that over the past month, these coronavirus have been declining steadily. But during the same period, or more recently, with the occurrence of variants in the province, we've seen that despite the measures that were in place, these variants were growing steadily week after week. And we see that for these variants, what we call the reproductive number is well above 1. It's 1.3. And this means that with the current situation, the number of cases will increase quite rapidly because it's multiplicative. And when you multiply a small number like we did in the past few weeks, it doesn't appear to be big, but when you get to a certain level, then it increases very rapidly, like we've seen in Ontario.
I believe you said it could be all of your cases, or the vast majority of them by July, if I understand correctly. So let's talk about how to address that. You've also said the way to do it is to put new restrictions in place. Does this mean a return to lockdown, a return to more sort of blanket limiting measures?
So I guess at a population level for the virus, what matters is, do we have contacts that are conducive enough for transmission of the infection? And so you can have a population where you allow people to do things, but when they do these things and meet other people, they really apply carefully all the measures to protect themselves. They stay away from each other. They wear a mask. They wash their hands. And when they are sick, they go and consult to be tested and wait at home to get their results before moving on. And all these things are really important. And at this time, we know that for all of these aspects, there is a decrease in compliance by the population at a time where we have a more contagious virus. So there is obviously what the government can impose, but there is also what the population can do in terms of its own behavior to minimize the risk of transmission.
I do want to ask you, though, specifically in Quebec, looking at reopening spas and gyms in red zones, Is that a good move? I mean, you're talking about proper follow-up and people's individual responsibility, but obviously that literally opens some doors.
Yeah, well, I guess opening spas and gyms is providing an opportunity for people to meet. The question is, will they behave in a way that will minimize the risk of transmission? And obviously, that if that happens, I think that the number of cases will surge so rapidly that there may be then this will force the government to go back to where we were previously. So I think, the variants are inevitable. So they will become the only player at a shorter or longer term. But what is important is the intensity of this wave due to variants may vary depending upon how we do when we are in presence of others.
Okay, I do want to ask you about another issue, which is the question of spacing out doses. We know that, for instance, the National Advisory Council on Immunization says it's looking at shortening the gap now because, Quebec sort of pioneered the way in terms of lengthening the gap. Now, though, for particular people, seniors, the immunocompromised, there seems to be some evidence to suggest it's not such a great idea to have those doses so spaced out. What should Quebec be doing? What would you advise Quebec to do on that issue?
Well, this is an ongoing discussion, and I think that we have to make a difference between what happens in elderly people and in people like immunosuppressed patients. In elderly people at the present time, we do have evidence that the vaccine does protect. Obviously, there are studies looking at antibody increase in elderly or compared to non-elderly patients. But at the end of the day, what matters is how protective is the vaccine. And the current evidence is that it does protect well, even people in long-term care facilities who are really old and frail. Having said that, it's a different issue when you're talking about people who may not respond well to their first dose. And so people like immunosuppressed patients may not mount a good response to the vaccine. And for them, they certainly need special considerations.
And so do you think that needs to be made policy then?
Well, this is certainly something that is discussed. Because again, the principle of the deferral for the second dose was that we knew that with the first dose, these individuals were largely protected. But if you get into a population where the first dose does not give this protection, they are probably they probably need to get their second dose sooner.
Mm-hmm. Okay. Well, we're going to leave the discussion there for today, but we really do appreciate your insights, Dr. De Serres.
My pleasure. Have a great evening.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.